I'm Dr. Drew, and this is Strictly Sex. Tonight, we are obviously in Las Vegas. And you know, as a physician, I think I've seen just about everything, but I'm still amazed how far people will go to try to improve their sex life. Vaginal rejuvenations, penis enlargements, how far would you go? Tonight, we're going to look into this. We're talking sex, drugs, and surgeries. Would you consider surgery?
No.
Never?
No.
How far would you go to enhance your sex life? Let's say your partner had a size problem. Would you encourage him to have a surgery to correct that? And if you were convinced that Viagra was safe for you, you'd use it. Hi, and welcome to Strictly Sex. I'm Dr. Drew, and the question of the night is, just how far would you go to improve your sex life? Will you consider surgery? Our show is full of answers, so I hope you'll stick around. Some of you may know me from television or radio, others maybe my books. I'm a physician, I'm a board-certified internist, and throughout my 20-year career, I've talked with a lot of people, mostly about sex and relationships, at least on radio and television, and I think I've learned a couple things. So let's take a look at what's coming up. In today's show, the extreme lengths some people will go to enhance their anatomies. We're talking bigger, longer, tighter, and wider, from penile enlargement to vaginal nip and tuck. We're getting into all of this. Let's start off with something fascinating. In a word, it's revirginization. Some women see it as a second chance. For others, it's a response to cultural or religious issues. Hymenoplasty. It's a surgical procedure that repairs the hymen and restores it to its original state. Now, here's Jeanette's story. Jeanette and Louis are a happily married couple.
I've been married to Louis for almost 17 years, and he's the most understanding husband.
I'm as attracted to her today, if not more, than I was when I met her. And Jeanette's just, she's my life.
Throughout most of their marriage, they've maintained a highly satisfying sex life. However, Jeanette has one regret.
I wasn't a virgin when I met my husband, and you know, when a woman shares her virginity with somebody, it's like the most intimate thing that she could do.
And so Jeanette is about to undergo a somewhat radical solution called hymenoplasty, an operation designed to restore her hymen, and thereby, at least as far as she's concerned, her virginity. What does that do as a woman? What does that give you back?
It's not so much that it gives me back anything as much as it's something that I can give to him.
The operation will be performed by Dr. Troy Robin Hailparn. The surgery is rare. Dr. Hailparn is one of only 12 doctors in the U.S. trained to perform it, and she has done just 5 hymenoplasties in the last year. Dr. Hailparn insists it's an important medical option. Now, this is kind of a controversial procedure. Some people are critical of it. Tell me what your thoughts are.
I must say that a lot of men, when they are with women who are virgins, do look at that as a big deal. And I think that the breaking of the hymen has something to do with, it's the first time for a woman is very special, most of the time.
So your wife has decided to have a hymenoplasty to restore the hymen. What did you think about that when she first came home and said, that's what I want to do?
I was like, are you sure? Doesn't make sense. It's already gone, you know. It's a new one, but it's not the one, you know.
Still, Louis supported his wife's decision, and Jeanette went in for the surgery. In an operation similar to this one, Dr. Hailparn finds the remnants of the original hymen and reconnects the tissue. Patients can expect a full recovery in 6 weeks.
There you go, one more stitch and we are officially finished.
Hymen restoration was very significant for this couple. Here to discuss this is the gynecologist who performed Jeanette's surgery. She's a specialist in vaginal reconstructive surgery and a diplomat at the American Board of Obstetrics and Gynecology. Please welcome Dr. Troy Hailparn. Thank you for joining us.
Thank you for having me.
So let's start with the basics. What is a hymen?
The hymen is the gateway to the vagina. It is basically a little rim of tissue that can go across the opening. It can go all the way across, it can go part way across, and it's variable from person to person.
Why do women have this reconstructed?
Women have different reasons for coming to me for this. Some women have had their hymens taken from them, whether it be child abuse or rape, and they want it to give of their own choosing. So some women will call and inquire as to whether or not we can restore it, so they have the choice to give it to whom they choose. There's also a small group of women who want to provide their partners with that revirginization experience because they weren't virgins when they met their partners. And again, it's a woman's choice and wanting to provide this experience.
And that's really Jeanette and Lewis's story, isn't it?
That is part of their story.
Interesting. Well, let's get back to their story. Did her surgery work? It's been 4 months since Jeanette had the surgery to restore her virginity. The surgery itself, how was it? Was it uncomfortable?
I did well. I didn't have any problems at all. It was not a horrible thing. It was good.
But the real question is, did it work? And when did you guys resume sexual activity?
February 14th.
Valentine's Day.
The couple chose to wait 3 months after the surgery before having sex. And so you lost your
Revirginity.
You lost your re-virginity on the day you met, 16 years
Later.
to the date, on Valentine's Day. How was that?
It was awesome. It was awesome.
It was wonderful. It was more than I expected.
Tell me.
Well, one, the fact that she would go through all that just for me meant a lot.
It meant everything. Being able to wait and share that with Lewis, and having him be so patient to wait, knowing that he didn't have to, from my heart to his, it was everything.
They were a nice couple. I enjoyed meeting them. Now, just to get it square with everybody again, it's 2 remnant pieces of tissue. Do you use the laser to get the tissues prepared?
Everybody is different and how they scar is different. So some people might have a small rim across, some people might have little pieces of tissue in clumps or groups. So you use the laser to basically make the edges raw, and then you use sutures to pull everything back together again. And usually you recreate it to at least 1/3 to 1/2 of the vaginal opening, so there's something to be penetrated.
It seems like we kind of lost track of the sort of meaning of virginity. It's sort of become a technicality, so why not have multiple hymenoplasties?
I think if somebody wanted that, they could achieve it as long as there's tissue there to keep recreating.
Would you do that?
Very rarely.
When you went into gynecology, did you have an expectation of doing this kind of procedure?
I never dreamed I would be recreating a hymen.
and how do you feel? What do you think now about it?
Well, yeah, it's just something else to add to my surgical skills.
That helps people.
That helps people.
Thank you very much, Dr. Hailparn.
You're welcome.
So why is it that virginity has become a technicality? Wasn't it originally supposed to mean chastity? Although most men I talk to are supportive of their partners, they're kind of bewildered by this decision. They don't understand so often why women would choose to do this. Like if I go out on the street and talk to men, they're sort of bewildered by the whole thing. But when I speak to the men whose partners had actually had the procedure, they believe that they participated in something special. Stay with us. Coming up, Dr. Hailparn invites me into her operating room to observe a procedure that's becoming very popular, laser vaginal rejuvenation.
Right now I'm opening up the back wall of the vagina.
Then, surgical procedures for penile enlargement. Oh boy. And later, plastic surgery. Have we gone too far? At least, maybe we have on this show. Strictly Sex will be right back.
I would never consider vaginal tightening. I believe in the Kegel exercise, stop, go, stop, go. Actually, I'm doing it right now.
I'd consider vaginal tightening after I have my couple kids. I guess I would consider a vaginal tightening because everyone wants a tighter vagina.
I would never consider vaginal tightening surgery because I've been told I do not need it.
I would definitely do it to please my husband one day.
Welcome back to Strictly Sex. I'm Dr. Drew, joined once again by Dr. Troy Robin Hailparn. Now listen, after childbirth, many women lose vaginal muscle tone, and that can mean diminished sexual satisfaction, right? But a procedure called laser vaginal rejuvenation restores the original structure and integrity of the vagina. Dr. Hailparn invited me into her operating room to observe this procedure on a young woman whose children weighed in at 10 pounds each, 3 of them. Denise and Joe were high school sweethearts. After 10 years of marriage, this happy couple has become disheartened to find their once satisfying sex life slipping away.
You're caught off guard, you're never prepared, and you don't expect this sort of thing to come up, and you quickly want to say, no, no, it doesn't, brush off, and then keep, keep going forward. But I noticed that it really started building up probably in the past year or so.
Though Denise misses the intimacy, she says her body just isn't the same after having her third child in 5 years. Denise says she's lost confidence in the appearance of her body, and as a result, she has difficulty feeling sexual.
From all aspects, everything seemed to change.
Well, how would you describe it?
In some cases, it looks like, the outer vaginal, the labia majora, it looks as though you've gained weight there. They look puffier, and also your opening is larger, and maybe your labia minora as well are longer, or they're just not the same length or size. It just doesn't look how you want it to look.
Did all this have an impact on your sex life?
Sometimes I would kill the mood by saying, don't I look fat down there, or do things look different to you, or, and he couldn't understand that, and that would be frustrating to him.
But she comes at you with, don't I look ugly or fat down there? What'd you say? What'd you think?
First of all, I don't see it as ugly. That's her perception of it. I see normal, 28-year-old attractive woman.
I don't want to be a normal 28-year-old
And
woman.
so for him telling you you're normal and beautiful, it makes you feel angry?
No, it's just unacceptable. Just that word normal, it gets thrown in your
You're
face.
better than normal. He said it to me. You're better than normal. You're beautiful.
But for every woman that's dealing with this, somebody that she tries to take this issue to is going to tell her that it's normal. But I would feel better and more comfortable if it was more aesthetically pleasing to me.
So he doesn't really identify, he doesn't empathize with how you're actually feeling.
Right.
Do you understand how she feels? Fill in the blank. I understand.
I understand she feels uncomfortable.
Do you?
Honestly?
Honestly?
I really don't. I really don't.
It's hard as a guy.
It is.
And what about this whole thing she's going through?
I'm there for her. I'm gonna see her from start to end, and I'm gonna be there to support her in any possible way.
Several gynecologists told Denise her problems were normal. But unsatisfied, Denise turned to Dr. Troy Robin Hailparn, who offered her a surgical solution to her complaints. And what are you going to do for her?
I'm going to tighten the back wall of the vagina, pull the muscles together to make the vaginal opening smaller, and I'm going to also take down the labia to even it out and make everything look symmetrical.
And so with Joe's blessing, Denise went in for surgery. I was fortunate to be invited into the OR to observe.
This is the yucky stuff right here.
The operation is called vaginal rejuvenation. Because the surgery is done by laser, there will be less blood loss, lower risk of infection, and a far faster healing time.
Right now I'm opening up the back wall of the vagina.
But will it work? And that's the big question we're going to find out in just a little bit. First, what do women generally think about their genitals? According to a poll we conducted on discoveryhealth.com, about 22% said they could use some improvement. 7% said they don't feel good about them. But 71% indicated they like their genitals just the way they are. That's most of you. We're back with Dr. Troy Robin Hailparn. So there's nearly a quarter of people out there uncomfortable, don't like how things look.
Well, they're probably more than that. Because it's over time that women become more aware. Between 20 and 30 and 30 and 40, women become more able to express their sexual needs and become less inhibited, and they also go through childbearing. And both of those have an impact on how they feel about their body and how much pleasure they get from their body.
I remember I talked to Denise and Joe, who you operated on Denise, and she was saying she didn't like how she looked down there, thereby she couldn't feel sexual. And this was bewildering to Joe. Joe was like, you look fine, everything's great, it feels great, but she couldn't.
Well, there's look, and there's function, and there's how you feel about your body, and they're all very much connected. Childbirth can stretch the front and the back walls of the vagina. It allows the bladder to drop down, the rectum to bulge up, it can cause pressure sensations, the opening is wider, and then also the intimacy factor. You're not feeling your partner the way you used to, and sex does change with time, but there are some things that we can truly have an impact on.
So how did you repair this?
Laser vaginal rejuvenation is a procedure that tightens the vagina. It tightens the front wall, it can tighten the back wall, and it tightens the vaginal opening. It can relieve the stress incontinence by better supporting the front wall where the bladder is, and it gives more pleasure by tightening the vaginal canal and the opening. And something else in terms of appearance is the labia minora, the tissue that protrudes from the labia majora. And that tissue can be unattractive to the woman who has them. They can also cause pain and be uncomfortable with intercourse and impact on various activities like biking or riding a horse.
That's where the labiaplasty comes in.
And that's where the labiaplasty comes in.
And Denise had that too, as I recall.
Yes, she did.
She had just one side done.
Yes, she did. Because of the asymmetry, one side was longer than the other.
And that's a pretty simple procedure. It's just using the laser and...
It's removing the tissue and then using meticulous, tiny little sutures to put everything back together again.
Interesting. How often do you do these?
I do between 15 and 20 a month right now.
Excellent. When we come back, we'll find out how Denise feels about her surgery and what her husband had to say about it. They'll be joining us here in the studio. And later, everyone has received at one time or another spam or emails about penile enlargement. But stick around. You're going to meet a Beverly Hills urologist who actually specializes in surgeries designed to enlarge the penis.
Most of these men have been ashamed of their size throughout their entire life.
Strictly Sex will return in just a few moments. Ready? Things on? Hey, this is Dr. Drew, and the following program contains candid material which is of a sexual nature. Watch out. Viewer discretion is advised. I mean it. It's not intended that the content of this show be relied upon for medical advice. No kidding. Look, if you believe you require medical or gynecological services, come on, consult your doctor. Have you ever heard of vaginal rejuvenation?
No, actually, this is the first time I've heard of it.
If a woman had children, you had say a wife who had babies, and it changed her vaginal appearance, would you encourage her to have surgery to repair that?
It'd be down to her for a decision on that one.
Up to her. Would these women have their vaginas rebuilt if they've been sort of distorted by delivery, baby, that kind of thing?
I understand that. If she wants to, then yeah, I'd let her.
You would have her do it?
Absolutely.
So it wouldn't be so much about what you wanted, it'd be more about what she wanted or needed?
Absolutely.
You get married, and she says all of a sudden, I want to put my hymen back. Sound like a good idea?
Sounds a little weird.
It's really up to her.
I don't know. I wouldn't really care, really. I mean, what's the difference, really?
It would be good for me, but to make her hurt again, wouldn't that be bad for her?
It's kind of confusing, right?
Very confusing.
Confusing, yes. And welcome back. We are exploring how far people will go to enhance their sex lives. We're following a relatively new surgical procedure called laser vaginal rejuvenation. So let's get back to the surgery. The first step in the procedure is the tightening of the vagina.
We've taken out about 1 centimeter to 2 centimeters, 1.5 to 2 centimeters of vaginal wall.
Then it's a matter of pulling the muscles together.
We're going to reapproximate the muscles to create a smaller vaginal opening.
This is done by removing excess tissue. The final part of the surgery will address another of Denise's cosmetic concerns. In a surprisingly simple procedure, the doctor shortens one of Denise's labia to make them both the same size. With that, the surgery is complete. Denise will remain in recovery until she's ready to go home.
Hey, Miss Denise, you're in recovery. You did fabulously well. Barely 2 teaspoons of blood loss, okay? How do you feel? Is your bottom sore? Not too bad?
Dr. Hailparn recommends the couple wait 6 weeks before having sex. And with us now are Denise and her husband, Joe, and of course, Dr. Hailparn. Now, Denise, it's been 2 months since the procedure. How'd it go?
It went very well.
Did it?
Yes.
What was the recovery like?
The recovery was about 6 weeks long, and it was not as traumatic as I expected.
Not a lot of pain?
Not a lot of pain at all. I only took pain pills for about 2 days.
Did you return to work and sort of normal functioning very quickly?
I did. I returned to work in 2 days as well.
And so the 6-week recovery is until you can have sex, 6 weeks?
Yes.
Joe, what's the deal?
That's what I asked.
I figured that.
To be quite honest, it's just an entirely new experience.
Yeah.
There is nothing that's parallel to the prior experience at all. You feel just, it's completely new. And
better?
And much, much better.
Much better. But now, my goodness, Dr. Hailparn, what's she talking about? What did you do?
Well, when you tighten the back wall and you tighten the vaginal opening, you create more friction, and friction increases sexual gratification. And when both partners aren't feeling it, and you can recreate it and make it tighter, it's better.
But Joe, I talked to you before the procedure, and there was no problem as far as you're concerned.
That's right.
It was going fine before.
That's
Is it
correct.
significantly better now?
It is.
It is. You're surprised. And then you had a concern about the cosmetic aspects of this. You didn't like how things looked.
Right.
You happier with that now, too?
I'm very happy with that. The change was quite significant and very dramatic almost immediately.
Now, if you remember, the thing that was bugging you is you couldn't feel sexual because you didn't like how it looked.
Right.
And he couldn't understand that, and that made you angry.
Right. Well, as women, we have all these comparisons in magazines. Everywhere you turn, everything is labeled with sex. Everything. And if anybody has seen any kind of, sexual magazine,
it looks a certain way.
It looks a certain way, and for the most part, when you've had children, it doesn't compare.
It doesn't look like that anymore.
At all.
So do you feel now, you have more sexual feelings, more apt to have sex?
I do.
So you got to be like the magazine again.
Yes.
And that makes you feel more sexy.
Yes.
Do you understand that?
I understand it now.
Or do you care?
He understands it.
He understands.
Trust me, he understands it.
So it's better for you too now.
Yes, it is.
I'll tell you why.
Tell me.
On the third night of my recovery, there's a, I was laying in bed and neither one of us had looked at it yet. And there's an anesthetic cream that you apply for purposes of pain. And I asked if he would apply it for me because I was kind of drowsy, and he turned on the light and he said, "Wow."
That is different. And so, Joe, when you applied the anesthetic cream, what'd you think?
Aesthetically, very, very different, very pleasing. I understood now what she was.
Surprisingly different, right?
Yes, it was.
And it wouldn't. I remember. I have to tell you, it was an elegant procedure, and seeing it afterwards, I thought, oh, okay, yeah, I understand why you want to do that. I guess if that's important to you.
Right.
Joe, closing thoughts. Why is it better?
I want everybody to understand one thing. We did not have sexual issues to begin with.
You said that repeatedly. You were
yes,
sort of
I did. I want to stress
that.
Sex is great, frequent, climax, all that good stuff. But if you can take that and multiply it by like 1,000, if you can imagine, it's just better. I don't know how to explain it. I did not know what I was missing because it was such a gradual process. Again, I think if this would have happened overnight, the relaxation, I think it would have been noticeable.
Yes,
but because it was a duration of, we're talking about 10 years now that we've been together.
And if I could paraphrase, your wife wants to have sex with you more often.
Yeah.
Okay. So, okay. Thank you, Denise. Joe, thank you, Dr. Hailparn, for the information on laser vaginal rejuvenation. If you want more information, go to our website at discoveryhealth.com.